everybody. So this is discussion 2 in Nursing 450, and for this discussion, we were given a list of evidence-based practice models that are available to nurses, and we were to pick one of the models and basically provide a summary of the model as well as describe how this model could be useful for us in our work or even some area that we were interested in nursing. So with that being said, I chose the Johns Hopkins Nursing Evidence-Based Practice Model. This is a model that is described on the Johns Hopkins website as a powerful problem-solving approach to clinical decision-making and is accompanied by user-friendly tools to guide an individual or group. It is also designed specifically to meet the needs of a practicing nurse, and it uses a 3-step process called PET. So the 3 steps are to develop a practice question, evidence, and translation. So for practice, that would be developing and refining the question of your interest. Evidence is researching, praising, summarizing, and synthesizing external sources of evidence for your topic. And then translation is to create as well as implement an action plan and evaluate the outcomes and describe your findings. So I think that the goal of this model is to ensure that the latest and best research findings as well as best practices are quickly incorporated into our patient care so we can quickly get the patients the best care possible. So how I can relate this to my clinical practice, I currently work in a cardiac stress lab. So we do Dopamine stress echoes, Lexiscan stress tests, as well as exercise stress tests. And one of our biggest problems is patient compliance. You have to be free, you cannot have any nicotine for 12 hours, caffeine or nicotine for 12 hours before your test. As we all know, caffeine and nicotine are vasoconstrictors and it can cause an invalid test. Can give invalid test results, and it will make your test not accurate. So in the Mid-Ohio Valley, that can be a big problem for a lot of patients as caffeine and especially nicotine are a big part of their life. So for me, I started with the practice question, which is basically our caffeine and nicotine intake. That's our problem. That is going to be what we're going to try and solve. So how can we reduce non-compliance? For this, I have to now go to my evidence section, and I was thinking about what can I do to increase compliance, and how can I make this better, whether this be explaining the harm that caffeine or nicotine can cause to the test result and cause an invalid test, and explaining to the patients, calling the patients more. This was kind of my evidence, was just thinking in my mind, what can I do to try to convince the patient that it's worth not smoking for 12 hours. As well as if they come to us and say, yeah, I smoke, then we unfortunately have to send them home. So it kind of can frustrate some patients. So for my translation or creating and implementing my action plan, I decided that maybe the best way would be to call the patient multiple times before the test, reminding them of this, what they'll have to do, as well as possibly emailing and mailing instructions, because we do try and call and sometimes they don't always answer. So maybe multiple forms of instructions that they can read over, as well as benefits of the compliance. So we don't want a patient to have an invalid test. So explaining to them that it's not because we just don't want them to smoke, that it's actually is a reason why we do not want them to have nicotine, can sometimes help with compliance. So I overall think that this evidence model is very useful in sorting out problems and can improve our patient outcomes. Thank you.